is the realization that vaccine is being made real time. It's coming off the line, and they are projections. We have every confidence that we'll have enough vaccines, but it's a very human, when you're dealing with very human process, it's biologics have to be made very carefully. So we are making projections 3 weeks ahead of time, but we want to be fully transparent on what we see coming, and we are trying to do that.
Thank you, Doctor. I guess my last question, I'll try to, in the remaining time, ask this question of Dr. Fauci, if others wanted to chime in if we have time. But this is really just projecting the biggest challenges you think we face, the most urgent, the most difficult. I realize they can be multiple at the same time, but Dr. Fauci, when you look forward just down the road a few months, in terms of just the public health challenge we have, how would you rank or itemize the challenges that we face? Are you more concerned about the impact of variants, or the struggle to get people vaccinated, or is it both, or do you have some other worries that I haven't articulated? And I know others may have spoken to this earlier, but I'd like to get your view.
Thank you for the question. There are a couple of things that concern me. Probably the one that's the most prominent is my concern that we will declare victory prematurely. If you look at the dynamics of the outbreak, it's a very, very high peak that we had following the holiday season that was expected to have a peak, but not that high. It really went up to 300,000 to 400,000 new cases a day at one point. It's coming down sharply now, but we seem to be plateauing at a level that's unacceptably high, around 50 or so thousand cases a day. This is what's happened in previous surges, where you come to a plateau at a high level and then you start to surge. Europe is generally about 3 to 4 weeks ahead of us in the dynamics of their outbreak. And what they saw a little while ago was a plateauing of their decrement. They were coming down nicely, and then they plateaued. And just as you might have predicted, they then started to go up. And a couple of weeks ago, they had a 9% increase. Now they have about a 5% increase. I'm concerned that if we pull back in our enthusiasm for the fact that vaccines are rolling out and things look good, if we pull back prematurely, we may trigger another surge. And that would really set us back in all the things that we're trying to do.
Thank you, Senator Casey.
Thank you.
Senator Braun.
Thank you, Madam Chair. My questions are going to be for Dr. Fauci and Dr. Marks. Going to be two questions. One, you can sense the frustration from Senator Paul, Cassidy, Murkowski, many of us, because we know we don't have complete data. We know we got to stay disciplined before we get this thing under control. But in kind of a top level way that I'm looking at it, we got to get to herd immunity through natural infection or vaccination. I want to make sure that you can take that in vaccinations and come up with herd immunity. If the conferred immunity is going to be about as good with a vaccination versus getting the infection, I'm taking 30 million as number of cases tested. Would like your opinion on how many completed vaccinations there have been. And then the big variable, how many untested cases to get to that 250 million. And like your opinion on those numbers, because when you can give us a little bit of certainty or idea on that, it gives us hope, like Senator Paul said, to maybe stay tough and get through it. Second question would be, if vaccinations aren't as effective as we want them to be due to a cascade of variants, then do we need to turn our attention to therapeutics if this is going to be something we battle with over the long haul?
So thank you for that question. I want to just harken back to what I had said a couple of some time ago to Senator Burr and some of the comments that Dr. Walensky had made about this magical terminology of herd immunity. We could get to where you and Senator Murkowski and others want to get without necessarily reaching this arbitrary percentage, because as Dr. Walensky said, it's going to really depend on a number of things, because it depends on what the RO of the viruses. And if you have variants that come in, they'll modify it. There are a lot of things that modify it. I like to look at it in a different way. I'd like to look at it in that every day we get 2 to 3 million more people vaccinated. We also still get people infected. If you look at the number of people that are protected, we don't necessarily have to reach 85% of the population to get to the things that you were asking for about your businesses in Alaska and about schools being open the way Senator Collins had said. We can approach that in a real meaningful way before we get to this magical number. So I made the
estimate. Do you think there are untested but out there? Because to me, that's the big plug-in variable. I'm reading 4 to 5. Is it 4 to 5 or is it closer to 2 or 3? And if we have no idea, that's the biggest variable when you get to that point where you get to what you're talking about.
Yeah.
What do you do in your modeling? How many untested cases do you plug into the model you're using?
No, see, there really is no model right now
Okay.
for herd immunity. It's purely an estimate. The only thing, take measles for a second. We absolutely know what the level of herd immunity is for measles because we've had multiple instances where when you went below a certain level of protection in the community, you had outbreaks. It's a highly transmissible virus. The vaccine is excellent, 98% effective. When you get down below 90% of the population being immune, when you get into the 80s, you get the kind of outbreaks that we saw in the New York City metropolitan area. We don't know that yet for coronavirus. We just don't know what it is.
I understand that. And what about if it seems to be an elusive thing to get through vaccinations and natural infection? Where do we start putting more emphasis on therapeutics?
Maybe I'll chime in. There is a fundamental difference between measles and COVID-19. Measles is a virus that does not vary with time the way that COVID-19
Right.
is varying. And the
Makes
reason
sense.
for having this issue of needing to have the best immunity you can and potentially vaccinating people who have already had COVID-19 is to get to high enough antibody levels to make sure that as these new variants come along, we are not basically decimated by yet another version of COVID-19 coming across the population. So it's essentially doing it right the first time to prevent another set of closures.
Which has a lot of kind of uncertainty, timeline, indefinite. And I think that's the tough thing I think you guys have to contend with. Let's get to the question of then therapeutics versus vaccines. Because isn't that the way we finally hammered AIDS, was with the therapy? You know, because a vaccine is never
for a global pandemic like we have here. I
Yep.
think we really have to probably. I'm going to defer to Dr. Walensky, who's more expert than I am, but I think vaccination is probably. Don't get me wrong, we need better therapeutics, and I'm absolutely right.
And/or natural infection, right?
I think we'd like to avoid natural infections because I think, as was already mentioned at this hearing, we have this COVID long hauler syndrome.
Right.
So I probably prefer not to have those people have those long-term effects. So we'd like to prevent natural infection by providing immunity through vaccination.
You want to add anything?
I agree completely that the idea of treatment as prevention, as we have with HIV, doesn't work because you're dealing with an acute syndrome that lasts just literally for a few weeks. Virologically, you may have persistence of symptoms. Treatment is important because you don't want people to get ill, and we've had 530,000+ deaths. You can avoid that with good treatment, but the dynamics of an outbreak absolutely is going to depend upon the vaccine.
Thank you.
Thank you very much. And I would just like to note that Dr. Fauci does need to leave at 12:15, so we're going to try and get through as many as we can. Senator Smith.
Thank you. Thank you very much, Chair Murray. I think you almost promoted me to doctor, but I'm not sure. I want to thank our panelists for being with us today. And as I've been listening to the testimony and also the questions that are being asked, I'm thinking about a conversation I had yesterday with the folks at Hennepin Healthcare, which is a safety net health system in Minnesota, level 1 trauma center in Minneapolis. And one of the things that one of the caregivers said really has stuck with me. He said, "We are just so worried here as we continue to grapple with the impacts of COVID in this community. that the world is going to move on. And, as Dr. Fauci and others have said, we're still seeing somewhere in the neighborhood of about 50,000 cases or more of COVID a day and 1,200 daily deaths. So I think it's important that we stay vigilant and keep our focus. And of course, also look to where the good news is. And I think we can do both of those things. Dr. Walensky, I want to ask you about something around vaccine distribution. This is a bright spot. So tribal nations in Minnesota have done an exceptional job in distributing the COVID-19 vaccine. And here's just one example. The White Earth Nation in northwestern Minnesota partnered with Monoman County to distribute the vaccine and has now, this county, one of the highest vaccination rates in the whole state. And what they did is they established a joint task force with the county, helped to streamline vaccine distribution and manage the supply in order to get the vaccine out. And today, White Earth Reservation, where of course there's a mix of native and non-native people living, and is a sovereign nation, so they set their own guidelines and about who can be vaccinated. Today, because of this close collaboration and the partnership that they have, they've been able to, anyone who is over 18 who lives on White Earth Reservation has been able to be vaccinated. So another example is the Boys Fort Mobile Vaccination Clinic, which is, they have brought, this is another northern Minnesota Ojibwe tribe. They have brought their mobile vaccination unit to tribal members in Duluth and in Minneapolis, those who don't live on tribal lands. So Dr. Walensky, could you just comment on why you think this is working and what this can teach us about addressing the challenges that we see around the country in getting equitable distribution of vaccines?
Thank you so much for that question, Senator. I think as I mentioned several weeks ago, we had a vaccine forum where we brought people together to talk about their best practices, lessons learned, how they've been able to distribute. We had over 100 tribal participants, and I don't know if those were specific examples that were given, but those are among the examples where we can say this is trusted partners, this is community engagement, this is people getting the message from people they know, places that they trust. This is part of why we want to engage at not the state level, not necessarily only the state level, or we need to get down to the local level. People don't necessarily want to hear from me that they should be getting their vaccine. They want to hear it from their local pharmacist. They want to hear it from their tribe members to say, we've all been doing this together. They may actually need to have it not just be convenient, but be able to revisit it and say, well, maybe I'm not ready today, but it turns out tomorrow I've noticed that 5 of my community members have gotten it, and they're willing to engage. I think these are important lessons that we need to that we are learning, and that we need to replicate those lessons in not just the tribes, but in other areas around the country, as well as rural areas around the country.
Thank you. I couldn't agree more with that. I think one of the things that's important about this is that we sometimes think that what we are experiencing is vaccine hesitancy, when actually what we are experiencing is a lack of access, and especially a lack of access from trusted providers. So I think it's important. Dr. Fauci, I want to try to get this question into you quickly. The Minneapolis Star-Tribune recently reported that Minnesotans are using websites for vaccine shopping. So they're trying to figure out what is the best brand and then shopping around for that and trying to figure out the benefits of one vaccine versus another. Dr. Fauci, what would be your message to people who are trying to compare the efficacy of these different vaccines as they are making decisions about how to move forward? What will you tell them?
Yeah, thank you for bringing that up, because that really is an important issue. We have 3 highly efficacious vaccines with a good safety profile. I think it is not appropriate, understandable, but not really appropriate to be shopping around to see which one you could get because you're making a guess of which one is better. The only way you know if one is better than the other is to do a head-to-head comparison in a clinical trial. So my advice when people ask me is that what is the most important thing is to get vaccinated as quickly as possible when your turn comes up to get vaccine. Which particular candidate you get is really not nearly as relevant as getting it as soon as you can. So if you go into a clinic and they have any of the one of the three available, I would just take it rather than waiting maybe a few weeks to a month for something that you think might be better. All three are highly efficacious.
Thank you so much. Thank you, Madam Chair.
Thank you. Senator Marshall.
Thank you, Madam Chair. Leadership is what America is now looking for. They're looking for a strong, consistent, honest voice from the NIH, from the CDC, the FDA, and from the White House. And frankly, Dr. Fauci, a nation is turning its lonely eyes to you for leadership. Let's talk about schools for a second. I think you all know and agree with me, our schools, our youth are in a mental health crisis. Our youth are suffering from increased instances of suicide, substance abuse, overdoses, depression, a true epidemic. And this was very predictable for all of us from the healthcare field, that when we closed down schools without the social interaction, we'd see increased mental health crisis, totally predictable. Let's talk about the science of viruses for just a second. As a private practice OBGYN for 25 years, I would tell you that viruses are predictably unpredictable, that how they impact a non-pregnant versus a pregnant woman certainly is different. And what I feel like when I try to listen very hard to you all is that that little science we do have is being presented as dogma, as gospel, and we know it's not. It's anecdotal at best. All I've heard so far today is basically anecdotal experiences. When it comes to schools, we need to hear a stronger voice from you all, from leadership. We need to hear a stronger voice, not a wishy-washy voice. And Dr. Fauci, I would ask you, do you agree with me that the benefits outweigh the risk of getting children back in school? Will you tell America we need to get our kids back to school?
I have said that repetitively. As you know, you've obviously been following what I've been saying. I've been saying the most important thing we need to do is to try as best as possible to get our children back to school safely. And that's exactly what I've been saying over and over again, right in this room in previous hearings. I think the chair has heard me say that multiple
Based
times.
upon everything we know about the virus, the epidemic we have now, do you feel the benefits outweigh the risk of getting children into schools across America?
Well, I mean, if you listen to the CDC's recommendations, that's exactly what they're saying. They're talking about the benefits versus the risk. And as you know, their guidelines are trying to get people to follow guidelines that will get the children back to school with the minimum risk.
I was hoping a yes or no answer, but I'll move on to mask. One mask, two masks, oh me, oh my. You know, President Biden recently said that we should all wear masks until everyone is vaccinated. That's probably the worst thing that could have been said for compliance. So many people have said, why would I go get a vaccine when the president says we have to keep wearing masks until everyone's vaccinated? We Americans feel like the goal line keeps moving. And I understand your fear of different variants and all those different things going on here, but where is the science that clearly shows wearing masks is helpful after you've had the vaccines? And for the sake of time, I need to move on, but all I've heard, I've heard the question asked already, and I've heard anecdotal evidence, but I would love to have you all send me the studies that show that it is absolutely beneficial to wear masks after you've been vaccinated or if you've had the virus. And we all want to know, you know, where is the goal line? When can we stop moving masks? I want to talk about the border, though. That's what I'm really concerned about. I just visited the border. My third trip there. It's certainly a humanitarian crisis, and I'm sure anyone that's been down there would agree with me that it's a national security crisis, but I want to talk about the healthcare crisis going on there. When I went down with a group of physicians 3 years ago or so, I was concerned about just the doctors, the nurses being overwhelmed. I was concerned about tuberculosis, hepatitis, scabies, sexually transmitted diseases, and other communicable diseases. But now, based upon what we know, the incidence of COVID is 5 to 25% of the people coming across the border. And then what I see is they take a group of folks, 50 to 60 people, they put them on one bus, and they do a couple of exams, and they all put them in some type of a dorm setting. So if they all didn't have the virus, they soon will, and then we let them go out into the public. That just seems hypocritical. You know, the application that you're talking about for when we can let ships come to Alaska, and the concern about variants from South Africa, that just seems It seems hypocritical to me. While I respect completely where you're coming from, it seems like it's a double standard. Dr. Fauci, are you comfortable with what we're doing on the border from an ID standpoint?
The reason I would have to hedge on that, because I'm not really very deeply familiar with the details of what's going on at the border. And that's perfectly honest with you, Dr. Marshall. I really am not familiar enough with the situation at the border to be able to make a comment. If I was, I would.
Whose job is it to know that?
I can chime in and say that I am aware that at CBP sites that there's overcrowding and that we need to, from an infectious disease standpoint, from a COVID standpoint, we need to de-densify what is happening at CBP. We have been working closely with ORR as our children leave CBP and move to the ORR sites to work towards getting them screened and tested, which is why they have, you know what % positivity they have there. Those ORR sites are much improved compared to the CBP sites with regard to how those children are cared for, who is caring for them, and we are providing technical guidance on those ORR sites to work to make sure that they are as safe as possible using mitigation strategies at their.
But do you see the hypocrisy in what we're doing to America? We're saying that I can't have a barbecue with my entire family on the July 4th. I can't have Easter service worship together. But we're going to let people come across the border in mass numbers and just release them into, does that not seem hypocritical?
I think there are two different situations that we have to handle. We have to handle in two different ways, and we have guidance and strategies for how we're providing technical guidance for the challenges that are occurring in the density at the border, and then we're trying to keep the public safe using evidence-based strategies there. Thank you.
Thank you. I yield back.
Thank you very much. Senator Rosen.
Thank you, Chair Murray, Ranking Member Burritt. I'd really like to thank all of the doctors for being here, for their tireless service to our nation, for their information, for their hard work in studying. And I'd like to just make this other comment that most of us here do understand that data takes time. Good data takes time. Coronavirus is a new virus. It hasn't been around that long. We haven't collected all the data to show us what the trends or variants may be. It's of course evolving, and that good data that will help us do the predictions that epidemiologists and doctors like yourselves help to do will be there. It's just a matter of time. I appreciate how quickly you're working on that. But we also have to keep focused, I believe, on treatment options as we have more variants, and of course, people will continue to contract the disease, and we know vaccinations need to go up, but we want to reduce the deaths if you do contract the disease. 5,100 Nevadans have already, over 5,100 have already died from COVID. I don't want to see that going up. And so I have introduced bipartisan legislation to hopefully track a diverse set of COVID patients, long-term longitudinal study, and report those findings on a regular basis. So Dr. Fauci, I've really appreciated so much the conversations we've had in the past, talk about monoclonal antibodies, other antivirals. We know both have helped. Like I said, people are still dying. So is it an issue of patients not having access to some of these? And what can you maybe tell us about what's in the pipeline for therapeutics for those who unfortunately may still contract the disease?
I had outlined, and I'll briefly repeat it in my opening statement, that we have therapeutics for people with early disease. The difficulty logistically is that getting people early enough to make it work. Monoclonal antibodies clearly work in the setting of getting people before they enter the hospital and before they develop advanced symptoms. Every study that's looked at monoclonal antibodies after a person has advanced disease in the hospital has shown no benefit. We do have good drugs for advanced disease, particularly the state-of-the-art of using dexamethasone with advanced individuals. We have a number of others under emergency use authorization. But getting to the point that I think you're suggesting, Senator, is that the real end game for this is to develop targeted antiviral drugs very similar to what we did so successfully with antiretrovirals for HIV and for curative therapies for hepatitis C. We are now investing a considerable amount of resources in doing that. We have a couple of candidates now that look good, that actually had been developed previously, that we're putting into phase 1, 2, and 2A and 2B trials. So you're absolutely correct. We need to do better on therapy, and the strategy for the future is the direct antiviral therapies that are similar to what we did with HIV. Thanks.
Well, I'd like to build on that then, because we hear about the long haulers or the long-term effects of COVID-19. We see people really suffering from this. We know about 30% of all COVID patients really continue to suffer from some form of ill-defined symptoms, prolonged fatigue, brain fog, as some people are calling that. It may render folks unable to go to work. It puts them at risk for continued social isolation and other kinds of issues. It may certainly decrease their immune system. And so we have to be sure that we don't deny benefits to these folks who have the long haul symptom. But what can you tell me about, Dr. Fauci, about NIH, how you're evaluating these troubling long-term health consequences? And are there treatments available? What's in the pipeline there for those that are continuing to suffer?
Right.
Some people sense a smell. I've heard rancid smell. Now they get their smell back, but everything smells sour or rotten.
Right.
What are you doing?
We've initiated a major program to the tune of $1.15 billion that we're doing at the NIH, also in collaboration with the CDC, and following cohorts of individuals to determine the incidence, the prevalence, how long these symptoms last. We have some studies say they go out up to 8 months or longer. You asked a very relevant question. What about treatment of them? It is very difficult to devise a therapeutic regimen when you don't know what the underlying pathogenic mechanism of the disease is. And that's the real stumbling block here, and why we are intensively studying these individuals, because although it is an absolutely real phenomenon, we don't have any pathogenic mechanisms right now that we're certain of that has a commonality among all of them. We will find that out, and when we do, then we'll be able to devise hopefully appropriate and effective therapies.
Well, thank you. Again, appreciate everything you're doing. Madam Chair, I yield back.
Thank you, Senator Rosen. Coach Tuberville.
Thank you, Senator Burke. Thank you very much. Thank y'all for your service. Kind of reminds me of my old job, 40 years coaching college football, sitting there listening to a bunch of armchair quarterbacks. Everybody's got the right idea of how to run your job. But thank you for what you're doing, because this country, and I guess 340 million people are counting on y'all, and several billion that's not in this country. So it's very important. And, you know, it just brings to the fact of where we are in this country on the campaign trail for the last 2 years. I kept telling people, really the last year, that, everybody thinks they're going to come up with a vaccine. Americans are going to come up with this vaccine, because that's what we do. But we need leadership. Dr. Fauci, you're the Tom Brady of the COVID team. You've had good days and you've had bad days, and we thank you for what you've done. We just need leadership from you and consistency. Everybody that I talk to, they understand where you're coming from, but sometimes we change in midstream. Coaches can't do that. You got to stay with what you believe in. So we just ask you to, just be firm with us. Tell us. You had people in here today, Senator Rand, talking about the mask. Tell us what you believe. Because we know very little about it. The American people don't know anything about it. Dr. Walensky, you got a tough job in front of you, and thank you for taking it on. Really. Again, this is not a Republican or a Democrat disease. This is a worldwide disease, and our kids are hurting. I will tell you that our kids are hurting. I've had friends that died. I've had people go out of business. We got to get this country back open as soon as we can. I mean, we can't drag our feet much longer, but we can't put people in harm's way either. We really can't. So, thank you for what you're doing. I'll reiterate what Mr. Marshall said, or Senator Marshall said, about people in Alabama can't understand why we're letting people in when we know some of them have the coronavirus. We're a loving country. We like everybody. My God, we put our lives on the line, our country on the line, our businesses and everything else on the line for the last year. And for some reason, the White House continues to let people in with this virus. And it's just mind-boggling to us that pay taxes, everybody that pays taxes, that will help them. This ain't the time. This is not the time to do it. And I think it's you guys' job is to go up there and say, listen, what are we doing? We can't do this anymore. We got to get the people back to work and kids back in school and go back to church and get back to normal life. And we've just got a double standard here right now it just amazes me. But again, I don't have any questions. Thank you for what you're doing. We're looking up to y'all and tell us what to do. Please tell us what to do and how to get through this, because we have a lot of people in trouble, mentally in trouble, not just physically, but mentally. Thank you very much. Thank you, Mr. Chairman.
Senator, can I make a comment just in response to something that you said that's really very important? When you have a static situation that doesn't change, when you do change your mind, then you're flip-flopping. But when you have an evolving situation, when the scientific evidence and data roll out and you learn more things in March that you didn't know in February, that you didn't know in January, that's the reason why you may hear us be saying things that seem to be different from one month to another, because you make a decision, you make a policy, you make a recommendation based on what's going on and the data at the time. So I just wanted to say that because you make a very good point when you were talking about consistency. We try to be consistent, but we have to be consistent with the data as it exists.
James, the game plan changes, doesn't it?
You bet. If you're playing against the zone or you're playing against a man-to-man, it's different.
You're exactly right. You're exactly right. But when you do change it, sell it and stick with it.
Right.
I mean, that's what we're all counting on.
Thank you.
We're counting on you. Thank you.
Appreciate it, sir.
Senator Moran.
Senator, gentlemen, ma'am, thank you for being here. Thank you for your service to our nation. Dr. Marks, it's nice to see you. I'll see you in the FDA and the appropriations process. And Dr. Kessler, thank you for your help in regard to helping us with the care for veterans. And we're working to pass legislation, passed the Senate last night with a conversation we had in our hearing about spouses and caregivers for veterans. So that issue that I raised with you is progressing. And Dr. Fauci, I didn't have enough of you in the appropriations process, so I've joined the Health Committee.
Great to see you.
Thank you very much. Let me just ask you a question, and then I think I'll visit with Dr. Walensky. It's going to be a bit outside of COVID-19, all that's related. So you better than anyone know the resources that NIH has devoted to combating COVID-19. The research and the response. I'd like to be reassured that despite that important work, that the other things that are important to America that are led by NIH research are not suffering. So how do you see the overall picture at NIH during this time of COVID-19?
I think I would not be totally frank with you if I told you that things are just exactly the way they were prior to COVID, Senator. There has been a diminution of activity in some areas for the simple reason that a lot of the clinical center, for example, is not going at full capacity for reasons that relate to the outbreak itself. As far as our grantees on the outside, we are continuing the same sort of support for all the other diseases that I know you're interested in. Cancer, heart disease, diabetes, Alzheimer's, Parkinson's, all of those are going well. But I think across the country, the same way that other areas of our society have been dampened down a bit by this outbreak, I think some of the research endeavor, by the very nature of when you shut down a lot of things, including accessibility, for example, of certain types of approach. But I want to give you my absolute promise, and I'm sure that Dr. Collins, were he here, he'd tell you the same thing. We give you our absolute commitment that we will do everything we can to make sure that nothing important slips in the other areas of research.
It's a matter of saving lives
Right.
with COVID and outside the other afflictions and diseases that
Right.
Americans are afflicted with. Let me turn to the CDC. Dr. Walensky, It seems important to me. I mean, I've heard while I have 3 hearings going on this morning at the same time, I've heard most of the testimony and responses to questions. And I certainly am a promoter and proponent of people being vaccinated. And I think that the CDC could be helpful if there are guidelines for instructions and suggestions for those who have been vaccinated were current and consistent and timely. So what is it that CDC would tell someone today that their behavior or conduct can change, or what their behavior or conduct should be following vaccination?
Thank you for that question, Senator. About a week ago, we released our first guidance on first step on what you can do if vaccinated. And that included things like small visits in your home, visits with other vaccinated people, unmasked and undistanced, so that you could dine with other vaccinated people in your home. You could also visit with unvaccinated people as long as people in their home don't have high risk of severe disease. So that is, we're still looking at data regarding whether people who are vaccinated can be asymptomatically infected and potentially transmit to other people. In that case, we wouldn't want you to be living with somebody who was immunocompromised on chemotherapy and whatnot, because we would worry about severe disease in that household. We've also released guidance on the fact that you don't have to quarantine if you have been exposed and you are vaccinated. So the quarantine has gone away with regard to people who are being vaccinated. We're revisiting what we should do regarding travel for those who are vaccinated, and that should be coming forward soon. That's going to likely be the next step in this regard. I want to remind people that we have now 12% of the population fully vaccinated, 39.9 million people. The initial guidance was released when we had 9% of people vaccinated. So as more and more people are getting vaccinated, as we are getting more and more data about the implications of vaccination with regard to asymptomatic infection and potential transmission, those guidelines will continue to emerge as you're requesting.
Let me suggest in the 2 seconds that I have left, or that I had left 5 seconds ago, that I would ask you to be concerned. This is true for every agency here that's represented here. A rumor in today's social media world, a rumor about a problem with a vaccine, a consequence, which could be false, but it is easy for fear to spread among Americans. You need to be prepared with the science and medicine to respond quickly to put down a rumor. And I hope that's the case in all of your circumstances.
Thank you, Senator Moran. Senator Lujan.
Thank you so very much, Chair. I really appreciate that. Dr. Fauci, before I begin with my questions, just wanted to ask you, does wearing masks stop the spread of COVID? Or help prevent the spread of COVID?
I'm sorry, sir. I didn't hear your question.
Dr. Fauci, does wearing masks help stop the spread of COVID?
Absolutely.
Should people keep wearing masks?
Absolutely.
I think there's a reason, Dr. Fauci, that even physicians, when they're in surgery and practicing, that they wear face coverings because it stops the spread of infection. And I think it's important. So just wanted to make sure that we gave you time to clarify that after some of the previous questions that have been asked today. Dr. Fauci, first to each and every one of our panelists, including yourself, thank you for what you've been doing to save people's lives and to defeat COVID-19. There are a couple areas where I do have some concerns, and it's based on some of the data. According to the CDC, Native American and Latino populations living in the United States are more than twice as likely to die of COVID-19 and more than 3 times as likely to be hospitalized as their white counterparts. Despite this data showing us that communities of color in the United States have been hit the hardest by this pandemic, Latino and Black people are receiving smaller share of vaccines compared to the larger population. On February 19th, Dr. Fauci, you said that racial disparity was very disturbing, and I appreciate that. Given the recent polling that there is little difference between racial groups in terms of how much they want a vaccine, how can the federal government and will the federal government increase access to vaccine in Latino, Native American, and Black communities?
This is a major initiative, Senator, that the administration, the president himself, is very serious about, and it has to do with any of the number of things that are being put in place to allow equity and easy accessibility. For example, community vaccine centers in areas that are demographically represented by minority communities, community health centers, the same thing, having pharmacies that are stocked with vaccines in areas where there are representation of minorities to a high degree, to have mobile units to go out into the community, particularly in those areas that are underserved, and to increase the number of vaccinators, people who can put vaccine into people's arms, be they military, be they retired physicians, nurses, and healthcare providers. This is a high priority for the administration to include equity into our vaccine program.
Appreciate that response. And while I do have some concerns and questions surrounding the decisions that were made by HRSA with the initial 250 sites that were identified, including the first 25, I appreciate the expansion of those sites to 750, which has expanded more sites in New Mexico, including in rural communities. With that being said, Dr. Fauci, I believe that the CDC Social Vulnerability Index, a measure that takes into account racial and socioeconomic factors and also rural communities, would be a useful index to allocate a certain percentage of vaccine doses to address these disparities. The state of New Mexico has designated 25% of vaccine doses based on SVI, and I know it was announced last month that FEMA has partnered with CDC to launch vaccination sites based on their SVI. Yes or no, do you agree that using SVI as a measure in allocating vaccine doses could potentially help address vaccine disparities?
I think it would, Senator. I would probably ask Dr. Walensky, since it is a CDC issue, if you have any comments on that.
Yes, we are using that. We are using SVI as a mechanism by which to include FEMA sites. We actually look at, in collaboration with FEMA, to look at both census data to make sure we're getting large populations, as well as SVI. We have a benchmark SVI. We're also looking at the SVI data for distribution. We know we have work to do in this area, and while we're looking at the data, we also know we don't need the data in order to improve, because we know we have improvements to make.
And I raised my concerns about HRSA's initial decision with the first 250 sites that were announced, the rollout of the first 25. And the first 250, New Mexico, which is a large geographical state that has many challenges, was only identified with one center. Dr. Kessler and Dr. Walensky, can I get your commitment today that future programs focusing on vaccine equity will serve not only underserved communities and urban centers, but also those in rural regions as well?
Maybe I'll just chime in here and say that I was really pleased yesterday when CDC announced $2.25 billion in funding to go towards testing in areas that needed more with regard to health equity. This was the first time that we've been able to directly give 19% of that funding specifically to rural jurisdictions. And so that effort is intended to reduce disparities, increase testing, increase mitigation strategies and education, and actually leave a workforce capacity in those areas.
So can I get your commitment that future programs will make that commitment to rural regions as well?
Senator, the answer is yes. Absolutely.
Appreciate that. Thank you. That's what I was looking for. And very much appreciate the explanation there. Thank you very much, Chair, and I yield back my time.
Thank you, Senator Lujan. Senator Byrd, do you have any additional questions?
Thanks, Senator Murray. Guys, we're at the end. I do want to make some comments that sort of tie together much of what we've heard today. Senator Kane said about a reference to a woman, maybe she didn't read the science. Well, I'm going to tell you something you already know. Most Americans don't read the science, and if they do, they're like me. They don't understand the data. And I think there is a lesson to that, and that is that when we put out guidance, when we make suggestions, you can reference to the science, but you have to say it in a way that the American people understand it. So it's not just the guidance that we need, it's an explanation in a common sense way as to why that's the guidance today, so that they can apply that to their own lives. Two, Senator Murray said something really important, that we need to do everything we can to raise the confidence of the American people to take the vaccine. To you, Dr. Walensky, guidance contributes to that. to Dr. Fauci, were he here, a simple pitch of if you take the vaccine, the data shows us you won't die and you won't go to the hospital. That's the most compelling argument to make to the American people today that I can think of. But we don't use plain words like that. We come up with something that's way too expanded that references something versus something that the American people will understand. Now, these are my comments. I hope the vaccine policy will change in the not too distant future with the appropriate focus on geographical, underserved, needed areas, where the policy is we're going to stick the next person in line. Now that we've addressed long-term care facility, congregate care, the most at risk, I fear, David, that in the not too distant future, we're going to be sitting there with vaccines and no arms to stick, based upon the inability of the American people to sort through this, or the frustration of staying up all night to try to get your reservation at CVS, and you finally say, I'm just going to wait until it opens wide open. I may be wrong, but what if I'm right? And I just implore all of you to begin to think through, at what point do we pivot where we say to the American people, if you're over 17, then the vaccine is available to you. Might have to go stand in line. You might have to get a reservation. But I remember the day I walked into a hospital that their specialty was bypass surgery. And when they explained to me that the first 2 surgeries in the morning actually spent the night in the hospital the night before, I was bewildered at this. And I said, why? And they said, because if they don't show up on time for their pre-op, then we miss 2 surgery windows, and those surgery windows are our profit. We'd break even that day if we miss those 2. Well, if we miss that next person in line, if we have to wait 5 minutes to stick that person, we haven't maximized the limitations that we have of people, professionals that can load that syringe and stick it in the arm. And I think that's going to become more and more a concern. Lastly, well, this first. With what we know today, our goal of everybody who would like a vaccine by the end of May, I think it is fairly easy to say to the American people, next fall, schools should open and they should all be in person. I think it's fairly easy to say, by the time we get to summer, Americans should fly and they should feel comfortable on an airplane. I think we should be able to tell people to plan their summer vacations. I think we should say next Thanksgiving and Christmas, plan to spend it with your families, both immediate and extended. We have to accept the fact that our goal right now is to be fully vaccinated then. And Dr. Walensky, I'm not saying travel to Germany or travel to wherever, because we're at the mercy of their vaccination schedule as to when we open it up. But let me just say to you, providing some certainty for next Thanksgiving, next Christmas, next school year, even if the CDC policy or the administration policy is not that we're going to open all schools today, we can sort of lean out over our skis and say, but if everything goes like we've got it designed, we can open in the fall, or we can open in person. And there are a lot of parents out there that will be relieved, and teachers are on notice and students are on notice. Last thing. I recognize the fact that a year ago when the pandemic hit, businesses altered what they did and how they did it. Schools altered what they did and how they did it. Government altered what they did and how they did it. Congress altered what we did and how we did it. The one thing that did not change at your agencies was the responsibility for everybody to show up, to do their job. For a year, we've been reliant on the healthcare professionals that work for you, with you, and beside you to do their job. If not, we would not be here a year later with 3 vaccines. We would not be here with ample supply of syringes and all the accompanying devices and PPE that's needed to carry out the most massive vaccination program that the world's ever seen. we wouldn't be in a position where we could be talking about, let's look around the corner and see how we prepare and what we learn from this. So I ask you all to go back to the people that work with you and for you and thank them on behalf of this committee and this Congress, because without them, we would not have the ability to have hope that this could soon be over. And we wouldn't have a commitment that we could explore how to make sure this doesn't happen again. So I thank each of you for your testimony today. Thank you for your indulgence, Madam Chair.
Thank you, Senator Burr. And what Senator Burr just said, I think, is probably the most important thing we have said to all of you in this committee hearing. Thank you to all of your staffs, everyone who's been working really hard on this, and appreciate all that they're doing. So thank you for bringing that up. I just have two additional questions and we'll close the hearing. First of all, Dr. Marks, I wanted to ask you, for a year now, your team has been working around the clock and making sure vaccines and therapeutics are being developed and are safe and effective, and we are all grateful for that work. But an important phase of this work is making sure that vaccines are safe for our children. And I know vaccine manufacturers have now begun work on clinical trials in pediatric populations. Can you update us quickly on what FDA is doing to authorize or approve vaccines and therapeutics for children?
Thanks very much for that question. So all of the manufacturers of the 3 currently authorized vaccines have plans. Either they have clinical trials ongoing or about to start trials in children. They are already trials very advanced in the adolescent age group that is 12 and over. And so there's hope, I think, as Dr. Fauci said, that we will be able to get that population vaccinated for the fall for junior high and high school students. And for the younger children, we do this stepped program of the trials will look at the older young children and then move down. And that's to make sure that we don't injure any children as we are looking at the vaccines. We have to make sure that every step is safe and we don't skip any steps because obviously the safety of our children is paramount. So I think we have a good program in place. We're working with the operation to make sure that that program really will move through. And the hope would be that towards the end of this year, we'll have data in the younger children.
Okay, very good. Thank you very much. And Dr. Walensky, this pandemic, as you know, has been especially deadly for communities of color and has exacerbated longstanding health inequities. Recent CDC data shows that Black and Latino people are more likely to die from COVID-19 compared to white people. In order to address these disparities effectively, we need to collect complete, reliable data that fully reveals the scope of the problem. Unfortunately, we are still dealing with incomplete race and ethnicity data when it comes to COVID-19, especially in regard to vaccinations. And even when we do collect data, it often doesn't break out in important groups like Native Hawaiian or Pacific Islanders. I wanted to ask you, what is the CDC doing to streamline data reporting and make sure it includes information on race and ethnicity from the states and other entities?
Thank you for that question. I think there are numerous components there. First of all, I think we need to realize that we know we have a problem before we collect the data. So we're actually actively working toward resolution of some of these issues, even without seeing the data. We know that access to vaccines is more among the white community than in the communities that have been hardest hit. So we need to act before we even see the data, but we need data as well. We're a data-driven organization and we need to see where the data are. When I came in, there were at least 7 or 8 states, I believe, that actually their data use agreements didn't allow them to report data to us that was in racial and ethnic divided. So we've been working closely with those states to make sure that we can resolve those data use agreements so that we can actually get those data. Once we get them, though, that's not actually the only challenge because, in fact, patients don't want to report. And so we have providers who don't ask the question. Many of these states' data forms say unknown, and so we get the race and ethnicity data. It's checked off, but it's said unknown, and that's not particularly helpful. So we're working with a lot of states to ensure that we can maybe get rid of that slot so that people have to report it. We are working to try and encourage people to report their race and ethnicity data. One way that we've been able to do this is through the electronic case reporting forms. So those reporting forms, and we've been scaling this up over the last several months, actually can link the test positivity with their medical record in Cerner or Epic, which actually report the race and ethnicity data. So we're working hard, and I think this is going to be a key component of data monetization.
Okay, thank you very much for that explanation. That ends our hearing today, and I really want to thank all of our colleagues and our witnesses, Dr. Fauci, Walensky, Kessler, and Marks, for a really thoughtful discussion. I think everybody wants you to say it's going to be over tomorrow, and nobody can predict that. And I know you're all working really hard to make sure we have the best scientific, informative information that we can to make good decisions about ourselves and our nation. For any senators who wish to ask additional questions, questions for the record will be due in 10 business days on Thursday, April 1st at 5 p.m. The hearing record will also remain open until then for members who wish to submit additional materials for the record. And this committee will next meet on Wednesday, March 24th in Dirksen 430 at 10 a.m. for a hearing on the nomination of Cindy Martin to serve as Deputy Secretary of Education. Thank you again to our witnesses. Committee stands adjourned.
Disagree. I don't know that the media makes it as bad as it seems to me.
Okay. So that
I
was
disagree with the whole, the statement that the media makes it worse. I don't agree with that.
right, because the next statement is blacks and other minorities do not receive equal treatment as whites in the criminal justice system, and you strongly agreed with that.
Yes, I do.
So, in terms of your opinion, right? I mean, you understand that, or it's your belief that discrimination exists.
Yes.
And that it's bad.
Yes.
And that as a result of that discrimination, black and other minorities do not receive equal treatment. You would agree with that?
Yes.
All right. So the question becomes based on that opinion, right? Is that going to affect your judgment of this case? If this case is not about race at all, for example, right? And it's a question of police practice and cause of death, is your judgment going to be impacted by your opinions as to discrimination in this?
No.
So if a police officer has an interaction with a minority, does that automatically make it discrimination, I guess?
No, no.
All right. You also, I think, have a fairly healthy respect for law enforcement. Is that fair to say?
Yes.
The question is presented, or the statement is presented, police in my community make me feel safe, and you strongly agree with that.
Yes.
there's a statement, a similar statement that says, I do not trust the police, and you somewhat disagree with that. Is there,
I don't distrust the police.
okay.
Is that what?
Yeah, I mean, I guess
Oh,
the police make you feel safe, and you strongly agree with
yeah,
that.
right.
But when it says, I don't trust the police, you don't strongly disagree. You somewhat disagree. So I'm asking, I guess, what is it that gives you some reservation to say, I don't trust the police?
They're human.
Okay, fair enough. Which my last question on these statements, there's a statement that says, because law enforcement officers have such dangerous jobs, it is not right to second guess decisions they make while on duty. And you somewhat disagree with that. So would you agree that converse is true, that there are circumstances wherein police decision-making needs to be examined?
Yes.
If a person testifies and they're a police officer, do you give their testimony more weight simply by virtue of the fact that they're a police officer?
No.
I think you said they're all human, right? Or we're
Yes,
all human.
exactly.
You indicated, or you were asked a series of questions about both Black Lives Matter and Blue Lives Matter. Your opinion about the statement Black Lives Matter is somewhat favorable, and your opinion as to the Blue Lives Matter is somewhat unfavorable. So I'll read to you what you wrote. With respect to Black Lives Matter, you wrote, I believe that Black lives do matter, and that this group is trying to highlight the injustices done to Black people, especially for just being Black. You'd stand by that proposition?
Yes.
Again, I mean, knowing that this case, if I were to say this case is not about race, right?
Right.
Can you set aside your perception of the Black Lives Matter or the Blue Lives Matter and judge the case based on the
its
evidence?
merit? Yes.
Great. Fine, ma'am, you were asked, do you want to serve as a juror in this case? You checked the box, not sure. And you wrote, this is an important case. The decision made by the jury will have a national consequence that is a heavy weight to carry no matter the outcome. So let me ask you, can you envision a situation, or can you envision the very real possibility that your verdict may be not guilty?
Yes.
Can you likewise envision a scenario where your verdict would be guilty?
Yes.
Can you apply the presumption of innocence?
Yes.
Will you?
Yes, I will.
So, to put it in another way, this is pay is terrible, right? To be a juror, it's a hard job. It requires a lot of attention. Why should you be a juror on this case?
I think I can be impartial and listen to instructions and go with what I'm given and ignore the outside stuff.
Fair enough. If I may have a moment, Your Honor.